Welcome to episode 8 of Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. These are brief conversations with CHEO's president and CEO, Alex Munter. This episode is a conversation between Alex and Dr. Melanie Buba, a CHEO hospital pediatrician and the medical director of medical inpatient services. Melanie is a proud graduate of the Northern Ontario School of Medicine's Laurentian University campus in Sudbury, her hometown. She and her team provide care to patients who are admitted to CHEO. In her medical director role, she leads innovation and change, improving care for children, youth, and families.
So your first exposure to CHEO would have been as a student or as a resident?
As a pediatric resident in 2011, and I'm still here.
Your dad's a surgeon.
He was an oral surgeon, so a little bit different. So went through dentistry and then did a couple extra years of training for that. And he was actually he was the only oral surgeon in Sudbury for probably 20 to 25 years. And I always had so much respect for what he did, and he loved his job. So he was a great role model for me.
Let's talk about the pandemic a little bit then.
Sure.
How has the pandemic changed your work as a physician, an inpatient physician at CHEO?
Most obviously, the types of patients that we're caring for during the pandemic has really shifted. It's no secret that our mental health and including eating disorder admissions have skyrocketed. I've never cared for so many patients admitted for those issues in my whole career here at CHEO. And it's been a lot of shifting in terms of how we deliver care, working very closely with our mental health and our adolescent medicine teams to ensure that patients get the care that they need. In terms of my administrative role, it's been a lot of, this week, this is what we're doing. Next week, this is what we're doing. And so being very quick on our feet, being very nimble. And I think at the very beginning, there was a lot of anxiety, understandably, and questions about COVID. And so really trying to lead people and help them feel confident that, everything is under control. This is a safe place. Yes, we don't know a lot, but we're going to find out, and we're going to make sure that everyone is safe. I have to say I'm very proud of the way CHEO as an organization, and particularly my area of inpatient medicine, has adapted to the pandemic. I've never seen teamwork the way that I've seen over the last 18 months. Everybody has really banded together. A lot of things that we've asked of people have been heavy, difficult things, and the resilience of our teams has really shone through, and people have taken on challenges, and I've been so impressed.
When you say you've never seen as many mental health patients, typically our mental health patients, psychiatric or eating disorder patients, are admitted to those units. They're not typically admitted to the medicine unit. Why are you seeing all these mental health patients?
Because there are more patients than there is space for them in their home units. So as you correctly indicated, we have our, mental health units, our eating disorder units, which are apart or separate from the inpatient medicine unit, which is sort of my jurisdiction. But because there have been such large numbers of these patients, one, there's just no physical space to have them housed on their home units. And secondly, from a physician and, team caring for them perspective, it's just impossible for, a small team to care for such a large number of patients. So they come admitted under general pediatric medicine, and we do our best to work with those specialized teams to continue to provide safe and high quality care to those patients, even though they're in a bit of a different place than they usually are.
Obviously, we're here to deliver medical care, but we also want kids to be able to be kids. Right? And so, the playrooms are closed, yes, and your big smile and friendly face is not visible to them. How have you experienced children, especially the younger children, through the pandemic? How are they doing?
You really see it in the families and in the caregivers of these patients, and how much they're struggling and how much they're missing the supports in the community and play groups and school and daycare. And so for those children, those younger children, it's really about providing as much compassionate care as possible to families. And sometimes caregivers just need someone to talk to who can empathize with their struggles and lend an ear. It's not, they don't have access to their friends and potentially some of their other supports in the community the way that they did pre-pandemic. So sometimes that's me. Sometimes that's our team. And I think, all of us would say that we've had conversations over the last year with caregivers that we've never had before. So I think that's definitely been different, but again, feeling very privileged to be in a position to be able to provide that support. I've had, again, a lot of very difficult conversation with teens over the last year who have been admitted, where they're admitted for, as an example, like a urinary tract infection, but most of the admission is spent talking about their mental health and how they're coping and how they could be more connected or who they can reach out to. So it's been a difficult year from that perspective. And I think the way we provide care, we've had to be a lot more sensitive to probably what people are dealing with that isn't always obvious, may not be the reason for coming to CHEO, but it's not infrequent where you walk in thinking we're going to talk about one thing and then the conversation turns to how much people are struggling.
You know, you talked about some of the changes that have happened, and really I'm so proud of CHEO's people really turning on a dime as new directions came, as new issues arose, and having to change approach. And so hundreds and hundreds of changes made. Can you talk about, in your area, in inpatient medicine, what's one of the biggest changes, and do you think it'll stay?
CHEO is now a leader in virtual care, certainly regionally, if not provincially, if not nationally. And I think that is something to be really proud of. In my area of inpatient medicine, we've totally reinvented healthcare to a certain extent by implementing something called virtual family-centered rounds. So for those in the audience who don't know what family-centered rounds are, it's an opportunity, a daily opportunity where the entire care team comes together, meets with a patient and a caregiver, and talks about the plan of care. Obviously, that's a little challenging to do with physical distancing and, the need for PPE to see patients up close, personal protective equipment. So what we created was a virtual version of that, where the nurse provides an iPad to the patient and the caregiver. The rest of the team is physically distanced in a conference room, all joining the same Zoom meeting and having a virtual conversation about the patient's daily care. And as we launched the process a year ago, we had a lot of patient and family feedback. And some of the feedback we heard from patients and families were things like, it's less intimidating not to have a giant group standing at the edge of the bed. It's much easier for us to advocate for our child or our own health. It's more confidential because we're all using earbuds instead of standing around a room or standing in a hallway. There were lots of parents who thought that this was a great way of keeping them involved in their child's care while keeping everyone safe. And others thought this might be something we want to do all the time. A caregiver wants to join, but is off-site because of work demands or other caregiving demands. Let's find a way to loop them into this virtual meeting, and then everybody can have a conversation in real time. So I do think there's great opportunities for this beyond the pandemic, and our team is starting to explore some of those now. And again, we continue to really take patient and family feedback very seriously and include it in everything that we do. And we hope that this will be something that people find useful moving forward.
Why pediatrics?
When I started doing more pediatrics and getting to know the people who did this work, I felt like I found my people. I found my home. This is where I belonged. Everyone was so kind and warm and compassionate and welcoming. It really felt like this is where I was supposed to be. And I've never thought differently. And to be honest, Alex, people ask me all the time, would you do something else? And truthfully, I would never do something else. This is my passion. This is what I was put on this planet to do. And I feel incredibly grateful and honored and privileged to do this job every day.
This has been Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. If you are considering joining the staff or medical staff at CHEO, visit the careers page at cheo.on.ca. CHEO is a global leader in pediatric healthcare and research. Based in Ottawa, CHEO includes a children's hospital, children's treatment centre, school, and research institute with satellite services throughout Eastern Ontario.